You good? Good morning. My name's Patrick. I'm going to be your student nurse today. We're just going to start off the day by me doing a physical assessment head to toe on you, just so I can make sure that everything looks and sounds as it should. So before we get started, I'm just going to wash my hands and then close this curtain to give us some privacy. Do you mind to tell me your name and date of birth?
Kayla, 12696.
And as I check her wristband, that is correct. So we are okay to start. I'm going to make sure I have enough light, make sure that she's in an okay position for the assessment. And then before I get started, do you use the bathroom?
Yeah.
Okay. So at this point, I'd help her down out of the bed. Watch her walk to and from the bathroom so that I can assess her gait and posture. Seeing if she's standing upright and walking well, not stumbling, that is good this morning. Help her back into bed. Is this a comfortable position for you?
Mm-hmm.
Okay, then I'd just raise the bed up to a good working height for me. And after that, I'm just going to start with a set of vitals. Check your temperature, your heart rate, your respirations, your O2 saturation, and your blood pressure. So I would get all of that. And while I'm checking her vital signs, I can ask her the orientation questions and check her level of consciousness based off her answers. So can you tell me where you're at this morning?
The hospital.
And what meal are you getting ready for?
Breakfast.
Okay. And then do you know what day of the week it is?
Thursday.
Okay. Seeing as she's answered all of my questions, she told me her name earlier when I asked her. She's oriented ×4. It's a person, place, situation, and time. And she didn't have any slurred speech or any delays when she was answering me, so her level of consciousness is good this morning as well. So since we got all that out of the way, I'm just going to start on my assessment now. I'm going to work starting at your head, working my way down to your toes. Do you have any pain? Do you need me to adjust the temperature, make it a little warmer? Just noticed you just had a cold chill.
Yeah.
All right, so since she's a little cold with that cold chill, I'd adjust the temperature, make sure that the patient is comfortable while we're doing this, and cover up any areas that I'm not currently inspecting for her privacy and her comfort. So then I'm going to start at your head, okay? Any pain in your head this morning?
No.
Okay. Since there's no pain, I'm going to start by inspecting her scalp, checking her hair color, hair distribution. It's nice and full. The color is good. There's no alopecia going on. As I look, I don't see any obvious signs of lice, so then I'm just going to move to palpating her scalp, checking for any excess heat, any lumps or bumps that I can't really see because of her hair. Everything feels good, and then as I run my fingers through, I don't see any signs of lice or anything else living there. So the scalp is good. I'm going to move down to your face now. I'm going to start by just looking at her face, checking for any kind of differences on either side, any swelling, any erythema. Seeing none, I'll move to palpating your sinuses. And there's no extra pressure, no extra heat to signify any kind of sinus infection. So then I'll move to her eyes. And as I look at her eyes, there's no drainage. The scleras are nice and white. The pupils are equal and round. There's no discoloration, no yellowing or redness or anything. So then I'm just going to shine a bright light into your eyes and check her pupil reactivity, block any light coming from the room. And as I shine the light into her eyes, her pupils constrict evenly, so they are working well this morning. Do you mind to follow my finger in towards your face?
Mm-hmm.
Convergence is good as both eyes move inward as my finger got closer. And then if you could just follow my finger to the corners without moving your head. And the eyes move well, so her accommodation is good this morning. And then one more test, if you could just follow my finger without moving your head again. And the eyes move nicely that way as well. So since everything is working as it should, I could go into her electronic health record and I'd be able to chart Perla with convergence since the eyes are moving as they should. Next, I'll move to her ears. And as I inspect the external ear, looking for any kind of lesions or polyps or swelling or anything. I don't see any of that. So then I will palpate her ears, making sure they are even and tender and that they're not hard or anything and they feel good. So then I'll just look in the internal ear for any excess drainage or redness, and seeing none, I would be able to chart that the ears are clear. Do you mind to look up so I can check your nose? As I look into the nose, there's no polyps or lesions or any excess drainage or redness, so the nose would be clear this morning. And then if you could open your mouth for me. As I take a look around, the mucous membranes are intact, everything is nice and moist. As I look at her tongue, there's no discoloration or any kind of lesions or cracking on the tongue, so the mouth is clear as well, good oral hygiene. Next, I'm just going to move down to your neck. Okay? Any pain in your neck today?
No.
So as I move to her neck, I'm going to check her carotid pulses one at a time. That way I don't cut off any blood supply to the brain. On her right side, it is +2 and regular. On her left side, it is +2 and regular. And then being able to put that information together, I would be able to say her pulse in her carotid arteries is even as well. The next step is I'm just going to pinch a flap of skin right here, and that is so I can check her skin turgor. And since there's no tinting and it recoils quickly, she's not dehydrated, we don't have to worry about any fluid deficiencies with her. Are you having any pain in your shoulders, in your chest, in your arms today? Okay. The first step when I move to her chest and arms is I'm just going to take a look at both arms, check the skin for any breakdown in skin integrity, any cuts, any erythema, any swelling that I can see. Seeing none, I'm going to move into palpating, starting at her shoulders, just kind of feeling for any masses or checking for any edema. And feeling none as I work my way into her arms and forearms. Everything feels even and as it should. So then I'm just going to check the pulses in your arms. I'll start at her brachial pulses. And they are even, regular, and +2. So then I'll move into her radial pulses. And they are even, regular, and +2 as well. While I'm down close to her hands, I'm just going to flip them over, take a look at her nails, make sure that the nail beds are nice and clean, they're the correct shape, the correct size, everything appears to be as it should. So then I'm going to squeeze your middle fingers. And as I do that, I'm checking the capillary refill to making sure she's getting good perfusion to her fingertips, and that she's got good blood flow all the way down to her fingers. Everything up here, they refilled quickly, almost instantly, so she is getting good blood flow all the way down. If you could squeeze these two fingers for me. As she squeezes, the strength is equal in both sides, so she doesn't have any weakness this morning on either side. And you said no pain in your chest, right?
No.
As I look at the skin on her chest, there's no obvious edema, no obvious erythema. It looks equal and healthy as the rest of the skin on her body does. So then I will move into palpating her chest. And as I start at the top of the chest and work my way towards the axilla and the breasts, I'll take extra caution to feel for any lumps or any signs that there might be a mass anywhere. Feeling none, I will then move into auscultating her heart and lung sounds. So I'm just going to put my stethoscope in a few different places and listen to your heart and your lungs. The first place I'm going to listen is the second intercostal on the right sternal border, excuse me. And I'm listening for the aortic valve here. And that sounds good, so I'll move to the second intercostal on the left sternal border, listening for the pulmonic valve. That one sounds good as well. So then I'll move to the fourth intercostal on the left sternal border and listen to the tricuspid valve. And that one sounds good. So then I'll move to the fifth intercostal at the midclavicular line, and here I will listen to the apical pulse for a full minute, as well as the mitral valve. About halfway there. 10 seconds. All right, and listening to the apical pulse, it was 74, which matches the pulse that I got when I took her vital signs in the beginning. So the heart is working as it should this morning. So then I'm just going to move to listening to a few spots on your chest, checking for your breath sounds, and just make sure your lungs are clear. And if you could take a deep breath in for me. And again. Again. And again. And then I'll move down here to get to the bases of her lungs. And one more time. And listening to both lungs, they both sound clear, no adventitious sounds such as wheezing or rhonchi from either side. So the fronts of her lungs appear to be clear this morning. Any pain in the backs of your shoulders, in the middle of your back, and your lower back today?
No.
Okay. Since she's not reporting any pain, I'm just going to start by looking at her scapulas, making sure there's no skin breakdown from laying in the bed and that the skin integrity is still good. And then I'll just kind of look over her whole back and check the skin for any erythema, any discoloration, or any kind of sores or anything. Seeing none, I'm going to move into palpating to check for edema or any extra heat.
There's no way. She can't see it in the camera.
And feeling no edema or any excess heat, I will move into auscultating her lung sounds from the back now. So I'm just going to put my stethoscope in a few different places and listen to the backs of your lungs. Deep breath in for me. And again. Again. And then I'll move out to her flanks so that I can check the bases of both lungs. So deep breath in. And one more time. And again, the backs of her lungs sound clear, no adventitious breath sounds, so the lungs are working well this morning. My next step would be to assist the patient into a supine position.
You're going to have to come to this side.
And then, do you have any abdominal pain today?
No.
Okay. Since she doesn't have any abdominal pain, the first thing I'm going to do is inspect, looking for any lumps, any erythema, any pulses from the abdominal aorta or any other part of her bowels. Seeing none, I'm going to move into auscultating for her bowel sounds. I'll start in the right lower quadrant since that's where the large intestine starts. And hearing bowel sounds, I'll move to the right upper quadrant. And hearing them there, the left upper quadrant. And hearing bowel sounds there, I'll move to the left lower quadrant. And hearing bowel sounds in all four quadrants, her peristalsis is working well. No obvious signs of any kind of obstruction. And you said no pain, right?
Mm-hmm.
Okay, since there's no pain, I'm just going to lightly feel around, checking for any edema or any masses or distension that might be present in the stomach. And feeling none, it would appear that her gastric system is working well this morning. So then I'm going to move down to her legs. So I'm just going to take a quick look at your legs, check your skin, and make sure that everything looks good. And as I do that, I'm looking for any kind of discoloration that could be a venous problem, any skin breakdown on the backs of her heels, again from laying in bed, just checking the overall skin integrity and health, making sure it looks nice and healthy like it does over the rest of her body. And from what I can tell, that would be the case. So then I would just move into palpating her legs. Again, checking for any excess heat, any kind of edema. If there was, I would check the pitting of the edema, but feeling none, I will then move into palpating her arteries and her pulses as I move down the legs. I'm going to start in your femoral artery. And feeling the pulse there, it is +2 regular and even. So then I would move to the popliteal artery. And again, it is +2, even and regular. And then I'll move to the posterior tibial artery. Once again, +2, even and regular. And finally, the dorsalis pedis artery. And it is again +2, regular and even. She's getting good blood flow all the way down to her feet. So now I'm just going to check her toenails, make sure they are a good shape and color and size, and they look good. I'm going to pinch her middle toes here and check for the capillary refill in the toes as well. And again, they both refill almost instantly. She's getting good perfusion and blood flow all the way down to her toes. I'm going to put my hands on your feet, and if you could press against me. And one more time. And both the plantar and dorsiflexion are good. Even strength in both sides, no weakness on either side. Having finished my assessment, I would then help the patient sit up into a comfortable position. Is it okay for you?
Mm-hmm.
Alrighty. Do you need anything else right now?
No.
Okay. Since she doesn't need anything else, I would remove any PPE I had on. I would then wash my hands, open the curtain, and let the patient know that I'll be back to check on him in just a little while.